CollabTalk is a copyright of Collaborative ABA Services, making a difference in children's lives.
Hi, welcome to CollabTalk, a new series by Collaborative ABA Services that provides information and resources about autism and everything in between. I am Alicia, the founder of Collaborative ABA Services, and I'm here with some of our amazing team members as always.
I'm Katie, I'm an occupational therapist.
I'm Bree, I'm a BCBA.
I'm Meg, I'm a licensed social worker and registered behavior technician.
So today we're talking about autism and medication. This topic often brings up some very strong emotions and varied perspectives among parents and caregivers. For some families, medication may not be considered an option due to cultural, spiritual, or personal beliefs, or maybe reserved reasons or concerns about side effects, long-term use, or the desire for more natural approaches. Mm-hmm. So we want to acknowledge that these feelings are valid. Please note that this episode is not meant to critique or endorse any specific providers, medications, therapies, or views. Our goal is really to educate and empower by sharing reliable information, raising awareness, and connecting our community to helpful resources so that families can make informed decisions that are right for them. Mm-hmm. So let's get into this topic of autism and medications. So the purpose of medication in autism, right? Mm-hmm. We know that medication is considered a supportive treatment for autism. It does not necessarily treat or cure autism.
Right. Yeah.
It just helps manage some occurring symptoms or conditions. So some common areas where medication can help may include symptoms of anxiety, those attention difficulties, what we see in an individual that might have a co-occurring disorder of autism, but in addition to ADHD, for example, some aggression and irritability, sleep disturbances may be one that we might see, and also some seizures, because we know that some individuals with autism may also have underlying medical conditions and may be prone to seizures as well.
And this is very common. Like it's autism is one of those diagnoses that is most often attributed or like accompanied by something else.
Right,
like it's not very common that autism is just on its own.
Right. And when we're looking at the different areas of medication management or for symptomology, some common medications used include what I was saying about attention and focus. So they use, call them stimulants, right? To use for like attention and focus. Also, they might have what they call SSRIs to help reduce those, obsessive behaviors. Antipsychotics is another one class of medications that are FDA approved for irritability and autism. And then also, which is very common, is melatonin for sleep disturbances, right? And even, it's interesting, like melatonin, may be used for sleep disturbances, but it's also might be used in kids that necessarily don't have autism as well.
My husband takes it. It's a very common over-the-counter medication that is not prescribed. Like you can pick it up on your own, but it helps to kind of regulate your natural circadian rhythms for sleep. So it's not necessarily a medication. It's more considered a supplement or support.
Right.
Right. Another type of medication that may be used is anticonvulsants.
Convulsants, for seizures.
Yep. Right. And we see that sometimes too in some of the kiddos that have a history of seizure medications. And some of those can be like life-saving, especially.
Yes, absolutely.
So what are some benefits and risks to medications?
Well, kind of with anything, right? Like there are the benefits of what the medication is prescribed for, what it can do, right? So if your child has anxiety, if your child is having impulsivity and safety issues and some inattention, like those medications can help remediate those symptoms, which can make it easier for your child to be present or available, or if they're having some mood challenges, to feel more regulated and calm. But with any medications, regardless of what you take it for, there are side effects. So I think some of the negative side effects can be, I know for ADHD medications, it can be appetite suppressants, so kids are less likely to eat. I know for some of the emotional regulation medicines, it can impact mood, so some kids can kind of be more like blasé, like kind of have that more flat affect. And then I know one of the biggest side effects for the anticonvulsant medication is irritability. So children who are on, say, Keppra or some of those other medications for seizures can sometimes have some anger challenges. They can get really kind of frustrated very easily.
Yeah, irritable.
I think one of the benefits, though, is working with your doctor on kind of weaning on and weaning off if it's not working out. Like, it's not something that's like a forever and now, oh, I tried this, now my child can't come off of it, and I don't like the side effects, but there's always kind of trials.
Yes.
Right.
You can trial things, not, to guinea pig method, but if it's not one size fits all,
right.
And I myself take a stimulant. They
Yeah.
don't all work the same. I've experienced appetite suppression with some like I get anxious and like racing heart. So
Right.
it's things that you need to try to find like kind of the right fit, just like with anything.
And you don't know what your child is going to react to, right? Especially if they've never had a medication before. So like, especially like you mentioned for the ADHD stuff, there are classes that are stimulants and then there are ones that are non-stimulants. And so you don't know if the child is going to have positive benefits with the stimulant or if they need a non one. So I think like you mentioned, just being very honest with your pediatrician or with your medical provider, saying like, hey, I really don't like these side effects. Do you have any other alternatives? Or, oh, I really don't want to do this. Can we try something else?
Right.
Like you kind of have that veto power. You can choose whether you want your child to be on a medication or not.
Right.
Like, that's kind of your choice. It's not always what the pediatrician suggests.
Right. And I think that like brings us to that informed decision making of like
Right.
having
Yes.
a pediatrician, a neurologist, or child psychologist involved, because I think it's really important to, leaning on them and asking them questions, but also making your informed decision of how you feel about it as well.
And when you're like part of that informed decision making, it's okay to kind of talk about what are my alternatives or
Right.
what are my choices, because as a parent or caregiver, you don't necessarily have to go with the first
Right.
option or choice given to you as far as medications. If you don't feel comfortable with a specific medication, it is okay to speak up and say, hey, I'm not feeling comfortable. And it could be through personal experience.
Right.
Because, providers don't always know histories or they don't always know. So like if you let them communicate, or if you have that open line of communication with them at your appointments, that can go a long way. So definitely talking about alternatives. Also talk about what are those short-term and long-term goals. It's okay to say, hey, is this medication going to be short-term, or is my child going to be on this medication forever? So that's a very important conversation. And also asking your doctor and even pharmacists, like, what are the side effects to this medication? And how do we monitor them, or what to do if I have these side effects?
Yeah, I think monitoring is a big piece too, because like as your child grows, as their metabolism changes,
Right.
as like, dietary things change, it can impact the medication differently. So like you mentioned, it's not like, okay, here you go, you're going to be on the same medication, same dosage
Right.
for the next 3 years. Like it's not,
Right.
it's not realistic to think that everything's going to be the same for a very long
Right.
time. So having like, what is the plan? How often are we going to check in? Like how many like times do we do this sort of thing?
Right.
It kind of just figuring out what their plan or kind of idea is for it.
Yeah, that happened with a previous client that I had that had gone through a giant growth spurt, and his stimulant that he was on, the dosage obviously needed to change because we were seeing a huge uptick in behaviors and his attention span, because he needed a higher dosage because he had grown so much. So I think it's important to like keep those things in mind too, and constantly be updating the pediatrician or whoever you're working with too.
And ask about, trial periods. Like, okay, we're starting a new medication.
Right.
How long or is my child going to be on this medication? Also, are the medication dosages going to change? Because I know with some medications, the dosages do change throughout time. So, and like what you said about your kiddo, like he grew older, or his weight changed, so they had to make some adjustments. So ask about those dosage changes, as well as the other piece is when you're looking at medication, that they can interact with other things, rather it be medications or supplements. So also asking about interactions with other meds. And also I find that the pharmacy, in addition to your doctor, pharmacies are very resourceful. You can ask those questions too, and the pharmacist will let you know, hey, these medications you can't take together, or you might have to take them apart, so many hours apart. And also they can be helpful in regards to letting you know if any medications don't interact well. A lot of times with the pharmacy systems nowadays, they will flag, and the pharmacy will know, like, hey, this patient can't take these meds.
Yeah. And that includes over-the-counter stuff too. Like I know sometimes depending on the medication you're on, even like simple cold medicines, certain ones, depending on what the ingredients are, don't mix well. So I think being honest with your pharmacist or your pediatrician of like, hey, they have a cold, can I give them this? Like kind of figuring out if that's going to impact that.
Right.
I think too, asking about different alternatives for like the administration. Like, does it come in liquid,
Yes.
chewable, capsule?
Yeah.
Because not all kids can tolerate,
Yeah.
you know, even swallowing the tiniest of capsule. And that, so like, does it come in different forms? How can I give it to them?
Right.
Can I
Yeah.
crush it? You know,
Right.
can I sprinkle it in juice? Can it be diluted? How can this be administered so that they can even tolerate taking it?
Right.
Some can even be in like a cream form if your
Yeah.
kid can't tolerate any of those kind of oral things. So they're very resourceful now.
And I think they can if it's liquid form, I think the pharmacist can also flavor it.
It can
if
be
you-
flavored or unflavored
Right.
depending on what
Unflavored,
your
yeah.
approach is. Yeah.
Valid points. So let's talk about some non-medication alternatives. So we know one of them is behavior therapy. Hint, hint, hint. ABA, for example. And then I know like for social work or social skills training is another one. What other therapies or alternatives?
OT. I would say the most common kind of style or the most common challenges I've seen my kids have that come to OT is that impulsivity or inattention. Like I've had a lot of families say, I don't know if my child has ADHD, but they're showing X, Y, and Z, or I don't know if my child has anxiety, but they're showing this. So sometimes OT can be a really great foyer pre-medication if you're not sure if it's a good fit, because working on those emotional regulation, those sensory things, those attention challenges. Sometimes I've had kids where they've done OT and it's been a phenomenal benefit, and the parents are like, oh, this is great, like I've got the tools, I collaborated with ABA, like this now works for me. And I've had some parents be like, okay, we've done the OT route, it's worked really well, but it's not quite enough. And then I'll usually recommend families, why don't we look into other supports.
Right. And then also in addition to occupational therapy, I think about also speech therapy
Yep.
is another one. Also looking at diet and lifestyle changes can be huge. So like managing those food sensitivities, especially if you're thinking of a kiddo that may not be able to communicate effectively. Certain foods can cause like discomfort, right?
Yep.
So they can't really communicate that, and that can also have an impact on their presentation or their behaviors or how they might appear. So definitely looking at those diet and lifestyle changes, and also Meg, piggyback what you said earlier about what the parent training and support are another one too.
I think the diet and the lifestyle changes are a big piece of it. Like if you're looking for alternative routes, if you're going to a naturopath or you're looking for kind of all holistic or kind of nature-based supplements to kind of support that, if medication like this big pharma is not really what you're looking for, one of the biggest things they'll do right off the bat is they'll ask, what does your child eat? How often do they sleep? Do they drink water? Do they only drink juice? And they'll kind of figure that out, because sometimes, like you mentioned, just changing the way that they eat or some of the things that they eat can make a big difference.
Valid point. So the next thing to consider too is we can discuss is some parent concerns and ethical considerations when it comes to medication. And I know one of the fears of a parent is the fear of over medicating your child, especially if they're on other medications, right? Or what they call using medication to quote unquote normalize behavior. Are there any other parent concerns or ethical considerations that you guys can think of that parents can kind of think about in regards to medications, or you come across?
I think one of the things is that it's a tool. Like it's not changing. Like sometimes families will tell me like, oh, I don't want to put them on medication because I don't want to change my child. Like I like who they are. I love their personality. I don't want to, especially the children that are a little bit more impulsive. I've heard like, I don't want to dim their spirit. And you're not, but I think kind of thinking about it's a tool. So if you have a certain expectation for your child, or schools requesting, or like you're looking for, my kid has a tough time doing X, and we're asking them to do X, and it's really tricky. Sometimes medication be considered a tool. Like I have kids who may only take it during the school year because it really helps them to focus and pay attention, or I have kids who will only take it like during the week, and on the weekends they don't take it. So I think kind of understanding that it doesn't necessarily have to be the only thing. It can sometimes be a tool to help your child bridge the gap between what they're struggling to do at that time.
So it sounds like with medication, it's kind of like you said, it's a tool. So it's balancing quality of life with managing stress. Also, when you're looking at medication and having that discussion for older children, teens, or even if you're working with an adult, like including them in the decision making is crucial, because they should be able to have some say if they're understanding and can give informed consent of because it's their bodies as well. And also, I think as a social worker, right, we're also looking at the bigger picture, and we want to make sure that we're respecting cultural, personal, and diversity informed values. So what one provider may believe, like, hey, this child needs medication, we also have to be knowledgeable and be considerate of the values of others. So now that we're talking about medication and autism, another thing to consider is that ongoing evaluation. So with medication, there needs to be some ongoing check-ins, or what we call med management appointments are huge. And, with those med management appointments, we know that, the provider wants to monitor changes in mood, appetite, energy, looking at if there's any behavior changes and overall functioning. And I think that's important for parents or caregivers to take advantage of with those med management appointments, is to make sure that they are keeping an ongoing open line of communication with their providers, and also making sure that they're meeting with their providers routinely and not missing any of those appointments, because those appointments are very important.
And I think one of the positive things that happened during COVID is telehealth appointments are way more accessible than they are now. So I think that most of the in-person appointments need to be so the person can have that face-to-face with the child or with the family to do that. But then those subsequent check-in appointments can be telehealth. So you can schedule it on your lunch break. You can schedule it, when your kids are home. So you don't have to feel concerned about, I can't make all these appointments. I'm not sure I can do it. They have a lot more flexibility now.
And also, when you are working with a provider, make sure that you are scheduled consistently. If you're not being seen at least monthly, I would definitely reach out and say, hey, when is my next appointment? Because especially when working with children, you want to make sure that you stay on top of those appointments.
They're held to, I think it's every 3 months by law to get your refills, and for them to be able to continuously prescribe.
So what are some resources and supports for parents or caregivers that are watching this episode?
I know that every single health insurance, you can go onto their website and they can talk about what medications are, like what the name of it is, what the different generics it can go by, what are the side effects, what are some of the counterindications. I know there are even some websites where you can put in 2 medications and see if they have a counteract. So I know that the internet can be a really great resource for families to learn more about what medications are, what they do, the different names.
There's also autism-specific healthcare providers too. If that's something that you're interested in, it's always available, as well as specific clinics and healthcare facilities.
And social media, just organically in the community, just talking to other parents and families who have maybe tried similar medications, or their children are experiencing similar behaviors or deficits, and how those medical modalities have worked out for them.
And also those national organizations like Autism Speaks, Autism Society are just a few. And also those evidence-based medical guidelines, kind of like what you were talking about earlier about the requirement of every 3 months. So looking at those medical guidelines as well. So I think today we covered a lot of ground as far as autism and medication. So just some final thoughts. We know, kind of piggyback what Katie said, medication is just one tool that is part of our the support plan, or helping to manage those symptoms of autism and other disorders. And it should always be part of a holistic approach to treatment and individualized that includes behavioral, educational, and emotional support. So it's not a one-size-fits-all. Every medication, kind of like what Meg was saying earlier, impacts people differently. So just keeping that in mind. And also, it's a personal decision. There's no right or wrong answer. It's based on what works better for that individual or that child and family. So in closure, thanks everyone for tuning into this episode of CollabTalk. If you found this information valuable, please don't forget to subscribe, and also hit the bell below so you never miss an episode. Got thoughts or questions? Drop them in our comments box. We'd love to hear from you. Until next time, let's keep this conversation going. To learn more about us, Collaborative ABA Services, check us out on our wonderful website at www.collaborativeabaservices.com and also our additional social media pages such as Instagram, Facebook, LinkedIn, and
TikTok.
yeah, that one, TikTok. Until next time, thank you. Bye.
CollabTalk is a copyright of Collaborative ABA Services, making a difference in children's lives.